So to start off as a background, we all know ultrasound is a common diagnostic medical procedure, and it works by using high-frequency sound waves to produce dynamic images known as sonograms of organs, muscles, tendons, ligaments, nerves, or blood flow inside the body. So the way it works is you have a transducer, which you can see here on the picture. That sends out a stream of high-frequency sound waves into the body, and it then detects the echoes as they bounce off of internal structures. From there, the sound waves are converted into electric impulses, which are processed to form an image displayed on a computer monitor. And it's from these images that videos and portraits are made. So this is just an example of an ultrasound image. In conventional ultrasound, structures that are very dense, such as bone, will show up as bright white. Intermediate density show up as a gray, and then low density, such as fluid or air, is black. So you can see here in this picture, this bright white, that's the humeral head. That's the greater tuberosity there. You can see the supraspinatus. So you get pretty nice resolution from the ultrasounds we have available today. So common uses of ultrasound that we all know about is OBGYN, abdominal imaging, cardiology. It's now commonly being used in musculoskeletal medicine. So we're able to look at soft tissue trauma, injury, as well as to guide our injections. So if you look at this picture, you see the old ultrasound machines. They're quite bulky. We have these newer machines now, much more sleek. You can move it easily from room to room in the office. You could even fold it up. It's portable. You could take it out onto the field if you're covering any athletics or into training rooms. So some of the benefits of ultrasound. Ultrasound itself is a painless procedure. It avoids claustrophobia and anxiety that we know a lot of patients suffer with if they have to go for an MRI or a CAT scan. They don't have to be still for a long amount of time as you would have to be with an MRI. It's totally safe because there's no radiation. We don't need contrast. It's cost effective. It's dynamic. And you can look at multiple joints views quickly and in one setting. And again, it allows precise targeted injections into areas of interest. So what are we injecting with ultrasound? So you can see we inject a lot of things, anything from joints, large joints like the knees and shoulders, to smaller joints in the hands and the foot. We can inject tendons, ligaments, nerve sheaths, nodules, and effusions. So you might ask, why do we even need the ultrasound? We know people have been doing injections forever. They haven't been using ultrasound. But if you look at the data, we have studies that show when we do blind injections, let's say for the knee, which is the largest joint in the body, we're only 80% accurate. So that means 20% of the time we're not in the joint when we think we are. When you look at the shoulder, we're only 30% accurate. So you can imagine the smaller the joint, the less accurate we are. So the ultrasound really gives us the ability to precisely place medicines accurately and painlessly into joints and areas of damage without the higher expense MRI or even, harm from radiation with CAT scan or fluoroscopy. So indications for ultrasound guided injections, you can see a lot of indications. So we can use it for diagnostic and therapeutic injection. Diagnostic injection, that might be where you just take lidocaine, place it into the area of damage, see if the pain goes away or not. We use it to treat arthritis, bursitis, tendinitis, effusions, that's a fluid collection, as well as aspiration of cysts, adhesive capsulitis or frozen shoulder, carpal tunnel, trigger finger, Morton's neuroma. So some of the medicines we're injecting, anything from lidocaine to steroids, viscosupplementation, and PRP, and I'll very briefly discuss each one. So lidocaine, we all know, common local anesthetic. We often use it to anesthetize the skin as well as for the diagnostic injections. Steroids, those are the most potent anti-inflammatory medicine we have available. Again, used for diagnostic and therapeutic purposes and has a wide variety of indications. So we use this to treat arthritis, bursitis, tendinitis, as well as carpal tunnel syndrome, frozen shoulder. Viscosupplementation, this is a procedure where you inject a gel-like substance known as hyaluronics or hyaluronic acid. That's a substance normally found in the joint, and it's to supplement the viscous properties of synovial fluid. So you could think of it like cushioning for a joint. Currently, it's only approved to treat arthritis of the knee, and only in those who failed more conservative treatment. So, people who failed the steroid shot, they failed physical therapy, oral medicines. We also use it for other joints, but those are currently under investigation. So platelet-rich plasma, PRP we hear a lot about in the media now with people like Tiger Woods or Heinz Ward getting it. This is plasma that's been enriched with platelets. And we know that platelets have a wide variety of growth factors, cytokines, and it promotes healing in areas that don't tend to heal well on their own. So the way we do platelet-rich plasma or PRP injection is that the patient first comes into the office. We draw their blood, usually from a vein in their arm. We then place it in a centrifuge machine, which will separate it out. And when it separates, you can see the yellow up here. That's the platelet poor plasma. The middle, that has the buffy coat, which has the platelets and the white blood cells. The very bottom, that's the red blood cells. So from there, you remove the buffy coat, that's the part that has the platelets, and you inject it into the area of damage. So common things we use it, we just heard about golfers, tennis elbow, doesn't have good blood supply, so it could be quite useful there, as well as plantar fasciitis, even early arthritis. Still investigational, so a lot of data is still coming out about it. So I just wanted to show some examples of ultrasound-guided injections. This is an example of a greater trochanteric bursa injection. So on this image here, the bright white, that's the greater trochanter. You see the gluteus and minimus and medius on top. And you could see the needle coming in here. And you see the bursa fills up very nicely. So nice thing about this injection is you see your needle the entire time. You're avoiding structures you don't want to hit, obviously, like vessels or nerves. And you can see very nicely that you're in the right area. And the bursa, it's not quite as large as we think it is. So you can imagine sometimes we think we're in the bursa and we're really not. So next example, this is an example of a hip injection. So the bright white here, that's the femoral head. This is the femoral neck. Head-neck junction, that's the target for the injection. You can even see the labrum here. You see the iliopsoas on top. This is the needle. You don't see it quite as well because you're coming in at a steeper angle, but you see the medicine very nicely filling up the hip joint. So again, you're avoiding structures like femoral artery, femoral nerve. You don't have to use radiation like you would with fluoroscopy. So very safe injection. And then one more example. This is an example of a shoulder injection. Bright white, that's the bone. You see the needle here nicely. And you see the medicine being deposited right into the area of interest. So in summary, ultrasound-guided injections are safe and effective, and they allow precise placement of medications into joints and areas of damage. Thank you.